Well, welcome to Deep Blue Perspective. I'm Steve Church, business consultant here at BluMine, and we are going to be talking today about February being Heart Health Month. I am joined by Julie Miller, the Vice President of Sales of BluMine. Welcome, Julie.
Thank you. Thanks so much.
Can you let everybody know where we are today? Because this is just a monumental step forward in the way we do our podcast.
Yes, we are so excited to partner with Bardstown High School and some of the students here to do our podcast. We had a chance to see the Polytech building when it was under construction and just dirt floors, and it has progressed and turned into so much more. So we're very grateful to the staff here to welcome us in and help us put together this podcast, and we look forward to doing several episodes with them.
Absolutely. And you know, it was 2 years, I think it was about 2 years ago, we were here for a luncheon and it was under construction, really literally was dirt floors. And to come back 2 years later and see this state-of-the-art building that has not only the visual arts production, it has robotics and all the other things that students are going to need in real life applications outside of their high school experience. And it's what a great leg up. I'm so excited for the future of our young people and getting to work with stuff like this. So thank you very much for having us. Julie, Heart Health Month, right?
Yeah.
That's where we are. We're a couple days before Valentine's, so it's so appropriate to talk about heart health. What does that mean when we're talking about the application at BluMine Health?
So many people think of heart health and they think of the dramatic moments. It must be heart attacks or big cardiac events and things like that. And so what we hope to do, especially focusing on heart health in February, is show people some love and explain that it doesn't have to be that dramatic. While those events occur, if we've done our job right, we hope that we are getting them on a preventative path and address some of those issues before it becomes that big cardiac event and get people on a healthier path sooner.
Yeah, as we were talking before we came in here, I was diagnosed as a young kid with a heart murmur, and it was a result of going to a primary care visit when I was a kid. But I managed that through the remaining of my life. I played football, I played baseball, I was a competitive swimmer. So when you have things under control and it is managed, then there's lots of things that you can do, and it's not a bad thing, right?
That's right. And so we want to take away the fear in addressing those concerns. You know, some people don't go to the doctor because they're scared of what they might find out.
Sure.
Or they don't know what to do with it once they've gotten that result, that they need to do something to address blood pressure, cholesterol, weight management, other things that can be contributing factors and put the stress on the heart, which is really the engine of the body.
Sure.
And so we want to help out with that.
Well, you just answered the next question, is that what conditions will BluMine diagnose, manage, help prevent? And so you mentioned high blood pressure, cholesterol, diabetes. What are some of the other ones?
Yeah, so we all know that getting to a healthier weight can make a difference, and we'll talk about that in a minute. But we can do the diagnostic testing in clinic so that they don't have to go someplace else. They don't have to wait for results. We can go ahead and get their lipid panel, their glucose, all those fun things, and give them the results right then, and start putting together a plan to get them to healthier numbers if they aren't, or to make sure that they stay healthy, So if they've got good numbers, we don't want that to go away. We want to make sure that we're helping them build good habits.
And why does early prevention and early management matter so much?
So if we wait until it is that ER event or it's something that has become more critical, it's not too late, but the damage may have already been done, right?
Sure.
And so before the heart damage occurs, we want people to think about some of the preventative things that they can do. And we also want to make sure that we get them into our care centers to check things out, because just because you feel good doesn't mean that there isn't something hidden there.
Right.
And so if we can address that and find that hidden issue to start doing something about it before the ambulance shows up in the driveway, we've done our job.
Well, and that's so true, because even with my condition right now, the high blood pressure, it's not symptomatic. It's just something that I live with. And so again, when the ambulance shows up, we all know those examples of we say, yeah, well, we saw that coming. We don't want that to happen.
Right.
So let's talk specifically about those chronic conditions, and the word chronic can sound a little overwhelming. Right?
It does. So many people, they don't want to be diagnosed with a chronic condition. So let's take the fear out of that. It doesn't have to be a death sentence. It doesn't have to be something that is scary and can't be turned around, right?
Sure.
So we want to take the fear away. We want to assure them that we can help them get on a better path, and that we have actionable items that we can do in clinic, and we're going to hold their hand as they go through that. So, when we think about that person that has been diagnosed with some type of cardiovascular issue, or they have a family history and that terrifies them to go in and have it checked out because they don't know what might be discovered, it's not hopeless. We can provide the path, hold their hand, and give them instruction on what they need to do to turn that around, and be proactive and take action before that ends up something bigger.
And so what is the benefit of going to a BluMine membership model versus the traditional, fee-for-service doctor or urgent treatment center or even the emergency room?
Sure. Well, the first thing you said, fee for service,
right,
and it's free to come to BluMine. So the employer is putting this in place, and it gives the members unlimited access. So no matter how often they need to come in, we can take care of them, and it's for the whole family. So we talked about building good habits. We hope that the mom and dad will bring in the kiddos too and start building those good habits with them. But we can establish a baseline, and then we can start tracking trends in their health, so that it's not just that one visit, and it's not rushed. So we can spend as much time with the patient as we need to get down to the root cause of some of those conditions that we find. So being able to access it at no cost, being able to spend the time with the practitioner that you need to and not be rushed, and really be able to have a conversation about that, and to be able to come back and see the same person, to build that relationship, and for them to get to know you and your health really makes a difference in doing something about it.
I love the concept of a baseline, because the thing that popped into my head is 401k. So you got $10 here, and then you can watch it grow or you can watch it shrink, right? And that's the same way with our heart health. We can get a baseline, we can watch it get better, or in some cases we can watch it get worse and put a plan in place. And I also love that the membership includes the whole family. I think that's a really great perk, because in my case, because we do see children from ages 2 to 26, so you can get an early diagnosis on things, a baseline if you will, and progress all the way through that child's early adulthood.
Absolutely, yeah, and that's what we want to do. Again, this isn't just about the individuals and the folks that are coming in that maybe have already been diagnosed with issues. When we think about what we want to give back to the community, we want to see the entire community getting healthier. So that's part of why we chose to make sure we're covering the whole family. We want to see everybody getting to a better path, and it all starts with small changes and catching things when they're little. For you, it was going to the doctor early and catching that. But as you progressed and grew up, you mentioned some of the sports events that you were in and activities, so you were already building good habits of exercise and things like that. So if we can instill that in the kiddos now and make sure that they're thinking about that, they'll be healthier adults later on.
Well, and not only is this facility great, but they've got a great football stadium that we walked right through, past to get here. And I could just imagine coming and watching, hopefully I'll have a grandchild soon, right? And watching my kid play football on this beautiful stadium, and being healthy enough to do that, that's a huge plus for your family.
Absolutely. I am so grateful that I can go to the soccer games and competitive cheer and everything else that my grandkids are involved in. But my kids were always very active too, and that was because they had parents that were very active too. So in making sure that we are doing those things, it doesn't mean that you have to be out there running marathons with your kids. But if you are participating in some kind of exercise, that's going to roll into what they're doing too. And we want to make sure that we're looking at things that are small changes, so drinking water instead of the sodas, thinking about incorporating a salad or healthy eating options, snack options. Again, it's all building the right habits.
Well, and we, there is an ROI on your health, right? The investment is making some small changes. The return is being able to do those activities and enjoy life with your families and your loved ones, right? So why is BluMine's approach so different than some of those other care opportunities that we have? I spoke about the ER, the urgent treatment center, the Kroger little clinic type things, right? Why are we different?
So we are more relationship based. We really focus on, we track how much time we spend with patients. So average visit is 34 minutes.
Wow. Okay.
Average time to get back and be seen is 3 to 8 minutes, depending on whether or not you've done that paperwork before you came in.
Sure.
Right?
Yeah. The dreaded paperwork. Yeah. The boon of my existence.
There we go.
Right.
But as we think about those things, we're doing proactive tracking. We're making sure that we're designing a health plan for each one of those folks. And I can't emphasize enough that it is relationship based. I don't know how many times I hear members that say, "Oh my goodness, my practitioner is so and so, and they take great care of me, and they know me when I come in, and I see them at the grocery, and we chat." So it really is designed to be like a family practice, and someone that cares about you, learns about you, and then incorporates that into the care plan that you have.
Before we got here, I went over and visited our clinic here in Bardstown, and I walked in, and Stephanie has this big smile on her face, and it's kind of like seeing an old friend, right? It's like, oh wow,
yes.
And that lowers your blood pressure too, because you know that you're dealing with somebody who actually cares about you, knows your family, knows your kiddos, knows what you're involved in, and that makes it a lot better. Right.
You just made a good point too. You said that
it's the first one today.
You were greeted. You were greeted when you came in, but we kind of joke about it. But I do believe that it's true. That even if you feel yucky, you're coming in for a cold or whatever else it might be, that you're going to feel 5% better just because you walked in our doors and the atmosphere that you have. So if we can make sure that that's a positive experience, chances are you're going to come back again too. And if you come back for follow-up care with us again. I can't emphasize enough, I know I've probably said it a half a dozen times, but putting you on the healthier path makes a difference.
Well, it certainly is a different feel when you walk into a BluMine Care Center than it is when you walk into any other ones. Big buzzword right now. Okay, we're talking about heart health, and we've talked about weight management. So what is BluMine's take on some of the medications that we see advertised, the Mounjaros, the Ozempics, the GLP-1s that are very prevalent and also happen to be very expensive, right? So where are we on those types of things, and share some insight?
Sure. I think there's several key things that BluMine does that maybe other practices aren't able to do, not because they don't want to, but maybe they just don't have the bandwidth to do it. Number one, we're going to do labs when we first start working with somebody on weight management.
Okay.
Our first go-to is not to put them on medication. Now, that doesn't mean that medication can't be an assistance to getting them to a healthy weight, but ultimately, we want to make sure that they aren't stuck being on that. So if the only solution, the only part of that plan is to put them on medication, it's not sustainable.
Gotcha.
So what we want to do is get a feel for where they are. We've talked about baseline a couple of times. So we want to see where they are right now. Then we want to make sure that we design a pathway for them to maybe incorporate medication with that. We also want to make sure that we're mindful of what their health plan allows. So what is covered, why is it covered? Do they allow weight management medications, or is it only if it's diabetes and things like that? So we're going to make sure that we coordinate that. And if you've tried to coordinate something with your health plan lately, it can be complicated, right?
Yep.
So we're going to be the quarterbacks for that to make sure that we help them get through that. And then it's also going to incorporate things like diet, exercise, but accountability. I think that's probably the biggest piece, is that you've got somebody to check in with once a month, once a week, however frequently you need. And we're going to talk about the mental parts of that, I guess, is the best way to say it. What things can derail you? What things can happen in your schedule, in your family life, that could cause you to not be successful in your weight loss journey? And so when we put all of those things together, it's a very holistic approach to make sure that you'll be successful.
You know, you just triggered a thought in my mind, and so many times we will be on a journey, whether it's, you know, a weight loss journey or whatever journey, and then you do get tripped up. And I'm reminded when I talk to young men particularly, I talk about going to Florida, leaving Louisville and going to Florida, right? And you get halfway through Georgia and you look down and you need some gas in your tank. And then you blow past the exit where the gas was and you have to go to the next exit. And I tell men all the time, because I usually talk with younger men, that doesn't mean you start over again in Louisville, right? Or in Bardstown. You're in Georgia, so you have made progress.
Yes.
And so you're not starting over when you trip up. You're just resetting, right? And that's what, you know, the accountability and the relationship that we have with our providers allows us to do. Okay, so you blew it and you went to Krispy Kreme and you had a dozen donuts, okay? But that doesn't mean that we...
Were you following me this morning?
No, I was not, but it does sound good right
now.
Yeah. But that doesn't mean you start over again, right? So we have the support there at the care centers that says, hey, okay, we had a bad weekend. Let's start again Monday and let's get it rolling again, right?
Exactly. Well, and again, it comes back to, it's accountability, but it's also encouragement.
Sure.
You know, so we want to make sure that folks feel like they are successful, and we're going to celebrate those things, and we're going to encourage them through the derailments. I mean, we just had Super Bowl. Most of us ate stuff that we didn't need to.
Yeah, yeah. The queso spinach dip did me in.
See, there we go.
I think I ate my weight in that. But you know, small improvements over time, they result in real freedom.
They do.
And we're talking about the cardiac stuff. We're talking about just overall health. Small improvements create freedom. So the last part that I know that we have been dealing with a lot as we sit in this wonderful environment with a lot of technology around us, we have really we've invested in technology to remind people. So if you are a current BluMine member, in the next couple of days you're probably going to get a reminder about this is Heart Health Month.
Right.
Why is it so important for us to do outreach to our clients and to our broker community to let them know what's going on in the clinic? Why worry about that?
That's a great question. You know, if you think about maybe some of the chores or tasks that you have to do right now,
right,
maybe they get put off if you don't have a reminder or if you don't have somebody nudging you to do that. So we're the nudge. We want to do those text blasts to make sure that people remember, hey, it's time for your annual checkup in your birth month,
right,
or have you had your biometric screening done lately, those kinds of things. Or if you've engaged with us, we want to make sure that you remember to come back in for those follow-up appointments. So there's several different things that we do. Built into our EMR system, it has reminders, not annoying reminders, but you can choose the frequency, but different things like that that'll help you stay on task to do those things. And we also know that sometimes people will be afraid to make that first appointment.
They will.
So if we can reach out to them and say, hey, go ahead and schedule. Let's just establish care, you know? And once they come in and they see that it's a friendly environment, that it's not scary, that we've got great people working there that are just going to embrace them and make sure that they feel comfortable, I think that makes a big difference. So we go to them. We don't just wait for them to make that first appointment. We're trying to get in front of them and make sure that they know what services they have available with us.
Yeah, and just as a reminder, you know, we are a membership-based organization, so you just can't walk in off the street and go to a BluMine clinic. You have had to have established a membership, much like a Planet Fitness, for your health, right? So you go to the gym to get healthier, you go to BluMine to continue on that path with a baseline on the biometrics, getting where you are, where you need to go, and then we support that. So overall, very, very, it's a holistic approach, and because we're in Heart Health Month, we're dealing with the cardiovascular system mostly today, but in general, we can do the sniffles, we can do earaches, we can do 70% of the health care that you get we can provide in our walls of our care centers. So keep that in mind if you're a broker watching this, or if you're a prospective client watching this. It's not just about cardiac, it's about the whole body, mental, nervous, all those things we do service in our walls. Again, 70% of all healthcare we can provide within the walls. So wrapping up, Julie, I have always learned something when I'm with you, always have a great time. What would be your closing comments as we wrap up this Heart Health Month Deep Blue perspective?
So, you know, we always talk about driving the human machine and making sure that we're taking care of it and doing the right things to keep that machine on the road. You know, the heart is probably the hardest working part of the body, you know, and to keep that healthy, to make sure that we keep it working hard for you so that we keep that human body on the machine or on the road, that's what we want to do. So come in and let us help you take care of your heart. Let us do that together, and let us show you some love for good health this month in February.
Well, this is Julie Miller. I'm Steve Church. This has been Deep Blue Perspective. We want to again thank the Bardstown High School and the Polytechnic facility here. This has really been an eye-opening experience for me. It's stepped up our game a little bit. We thank you for our wonderful producers and camera persons and the staff here. We will see you again next month. Until then, stay healthy. If you have any questions, call us. But more importantly, become a BluMine member. You'll really thank yourself 10 years down the road.
Happy Valentine's Day, everyone.
See ya.